Welcome back. I know it's so difficult at this time, at this hour of the day, to have such short coffee breaks, but we have very interesting conversations in here and would like to stay on time and respect your time. So my name is Valbona Zanelli. I'm a senior fellow with the Atlantic Council, and I'm delighted to be back at the Dubrovnik Forum, and I'm delighted, also honored to moderate this session. The topic of this panel is melting ice, rising stakes, critical materials, geopolitical competition, and global health. So there are a lot of topics that are included in our panel. So maybe we'll have taken the entire day to go through everything. So we meet at a moment where four crises that once were considered as separate, geopolitical competition, climate change, resource security, and global health, have converged into a single strategic challenge. And as I was pointing out, it will be difficult to unpack all of that, but we'll do our best because we really have assembled here a stellar panel. In our panel, we will have first the keynote speech from the Deputy Speaker of the Croatian Parliament, Mr. Željko Reiner. Our panelists are Ms. Irena Hrsić, the Minister of Health of Croatia. We have the State Minister for Foreign Affairs of Japan, Ms. Ayana Kunimitsu. Thank you for being here with us. The Regional Director for Europe at the World Health Organization, Mr. Hans-Henry Kluge. The co-founder and Secretary General of the Center for China and Globalization from China, Mabel Lu Miao. And Daniel Kokis, the Senior Fellow, Center for Europe and Eurasia at the Hudson Institute. Without further ado, we would like to start with the keynote speech from the Deputy Speaker of the Croatian Parliament. The floor is yours.
Thank you very much, ladies and gentlemen, Your Excellencies, good afternoon. The topics of this panel is extremely wide, as already told, but of tremendous interest in recent times. I'm glad that we have gathered in this format for a fruitful discussion about the need for updated strategies and politics. This is a complex issue for which we use a simple term, melting ice. I would like to challenge you, to inspire and provoke you today to give you most creative ideas on finding the best way of concerning the consequences of melting ice. Let's discuss the profound change which the Earth is facing and the fact that polar ice is disappearing, which humanity seems to have taken for granted for thousands of years. We can all agree that climate change is affecting every single aspect of the life of this planet, with the Arctic being extremely vulnerable to impacts of this change. What happens in the Arctic affects the world far beyond the polar regions. As the panel description suggests, our mutual aim is to define a more resilient and secure interconnected world. Therefore, not a single nation should think that a certain geographic area is too remote from the Arctic to be bothered by this. Consequences of this historic and permanent change that is thawing permafrost and melting ice have a potential to change the life on Earth as we know it. The international academia and global scientific institutions have suggested that the warming of the Arctic is 4 times faster than the global average. That means that we all need to act fast. Can we even start thinking about what is good for the Arctic without extensively communicating with the local communities and indigenous people? Whether we are thinking about it or not, the local communities are the first to be affected with every change that is looming behind the warming of this particular part of the world. Permafrost, thaw, and retreating ice expose land, and much of areas get uncovered extremely quickly. This might open a Pandora's box, since the question is the Arctic ready for sudden high interest, and what can the international community do to promote adequate rules and regulations framework that promotes preservation and sustainability? Moreover, the increased use of accessible shipping routes in the polar circle produce more marine litter and microplastics affecting sea life, harming species, disrupting food chains, and thus having an impact on the indigenous people who rely on hunting and fishing. At this point, I would like to mention green and digital transition, which is welcomed with open arms worldwide. However, will the world be able to resist exploiting the vast undiscovered oil and natural gas reserves in the polar resource-rich territories? Burning the newly accessible fossil fuels produces more greenhouse gases, melting the ice even further, and by the area is going backwards, so to say, in the ecological process. Moreover, with the disappearing ice, the Earth is losing the high albedo surfaces. Just to remind you, this is the measure of how much sunlight a surface reflects back into space rather than absorbing it. And low albedo surfaces are spreading, soaking in the sunlight and warming up the atmosphere, promoting further ice melting. We are all aware that the green energy transition, defense industry, artificial intelligence development require a major mobilization of modern technology, which needs the rare elements, which are until recently not accessible below the ice. The rare elements are now getting more and more accessible in the parts where the ice is disappearing. And I'm not talking only about those like neodymium or praseodymium, but also about major deposits of zinc, lead, silver, nickel, palladium, copper, iron ore, bauxite, and phosphate. We simply can't ignore that the need for these critical materials, particularly semiconductor-related minerals and so on, is opening new strategic frontiers, as well as a race and competition over these resources, reshaping even more the existing complex and unstable geopolitical relations, which might redefine military and economic power balance in the world. Largely unpredictable threat concerning the melting of ice is the process which leaves polar ecosystems exposed to the sun. Here we are talking about scenario from science fiction movies that might become reality. The dormant microbes, so-called time travelers, being forgotten but preserved for thousands of years, are now getting brought to life by exposing from other melted permafrost and melted polar lake beds. Therefore, melting of ice could cause some diseases outbreaks with pandemic potential. Those polar areas now more than ever attract frequent visiting for tourism and exploring industry potential, bringing people into closer contact with what was once isolated space. Focus has to be directed also on zoonosis in the Arctic. The pathogens may be parasites, rickettsial, viral, bacterial, but also prions, and can spread to humans by water, food, or the environmental factors. One important question is the Arctic ready to protect the health of people facing the climate change, melting ice, and the exposure to new diseases? What can be done globally to help those who are directly affected and to prevent the potential pandemics before they happen? Environmental changes have a direct impact on human health, because the climate change is not only melting ice, but also erasing the barriers between ecosystems. As society, we need to understand and to be prepared to enhance the awareness of the need for health plan and for the management of possible zoonoses. All stakeholders from different industries, like mining and shipping, but also governments and international community, should recognize the need to monitor health risks and to be able to rapidly adjust to fast changes in the polar environment. That has to be a robust monitoring based on international cooperation and transdisciplinary research collaboration, with the aim to build climate-resilient public health systems. To help from the indigenous community is indispensable for their knowledge of the areas of potential risk and of the early signs of ecosystem and health situation changes. Indigenous community cannot rely on the existing resources for health protection, but all the stakeholders need to consider ways to ensure efficient healthcare systems in the polar region. To finish, the rest of the world, and the Arctic in particular, do not need to witness a zero-sum game in finding ways how to ensure that global warming and ice melting is to be approached with the utmost care through analysis, thorough analysis, and dialogue of all stakeholders, using all the potential of science, expert knowledge, and diplomacy. And I'm sure that we will hear about this much more from these experts sitting here. Thank you very much.
Well, thank you very much, Honorable Reinhard. As you really very well pointed out in the introductory remarks, in the keynote, that the Arctic is no longer a frozen frontier, it's melting. But as it does, it's opening also new shipping lines and resource deposits, but also it's a new theater of great power competition in a contested strategic space. And then you pointed out that beneath it lie critical raw materials that are very important for are building blocks for the green transition, for the digital transition, for the defense industry of Europe. And also there is health. COVID-19 showed that it did not only kill millions of people throughout the world, but also it exposed the fragilities of our systems, the vulnerabilities of our system. And so all this, everything that you raised in the keynote speech, these are not abstract questions. Actually, they have consequences. They have consequences for the health systems, for the industrial policy, for prosperity, for defense spending. So they're all very well connected. So we'll try to explore this in the next 42 minutes. And will not promise easy answers, because from the very beginning, bringing these topics together mean that there are tensions between competition and cooperation, between multilateral ambition that countries have and national interests of countries, between the urgency of the challenges that need to be addressed and also the limits of our institutions, but also our financial limits. So I'd like to start with the Minister of Health of Croatia, Ms. Hrsić. So we heard and we saw what happened and the vulnerabilities that COVID-19 pandemic exposed in our systems. And now there's much more talk in Europe about this idea of having the health system be considered a critical infrastructure, part of the critical infrastructure for Europe's not only health, but also economic competitiveness, resilience, security. And so in your opinion, and also bringing the Croatian perspective, how can health be more effectively integrated into the broader conversations that we have on security and resilience?
Thank you for the question. And I think at the beginning I would like to thank the organizer to bringing the health into the topics during this meeting, because I really think that even we do not think that the health system is important, but you mentioned, and our introducer also have said how the healthy people, how the healthy nation, how the healthy world can deal with all the problems. We all experienced what happened during the pandemic period, and I need to remember all others, and for those who didn't know, but Croatia also had a heavy earthquake at that time. So we had at the same time two problems, two crises to deal with it. So we managed. And at that time, what is important and why the health system is important, because you notice that when you are fragile. So at that time, health system was very fragile in Croatia, not just because of COVID and because of the earthquake. And at that time, we realized how health system is a critical infrastructure. I'm talking from my point of view because I'm a physician. So during my medical school, during the time that I was a medical director of a hospital, I never thought that the health system can be damaged in any kind. But at that time, we saw how one crisis can involve in a health system in any country, so in Croatia, and we learned a lot. At the beginning of our this forum, during the opening ceremony, our Minister of Foreign Affairs have said that we need to give the correct answers and to be honest. I can say that the healthcare system is critical infrastructure, but we need to build it more, to be more resilient, to be more connected. But if we have in mind that the health system is changing rapidly, we heard at the beginning that the changing in medicine is very fast. But if you want to be resilient and if you want to be stable, you need to be fast and efficient. So I think that we need to have in mind all the time that the health system is a very critical infrastructure, and when we are dealing for some changes for health system, I will say it from Croatia and from my point of view as a Minister of Health, I need to think broadly. So I need to think that we are part of European Union, and European Union learned a lot from the crisis, and Croatia is part of European Union, but we need to think about the specific things that we have in Croatia. We are not that big country, but we are an important country. Our people, healthy people, is very important, not just for economic, it's as much as people are healthy, the nation is healthy. So health system is a critical infrastructure, and we need to be aware of that for all time.
Minister, thank you very much. You mentioned a couple of times the European Union, and I was wondering, how many times health ministers meet during the meetings, the council meetings, for example?
You mean during the pandemic?
Not only during the pandemic, and I think that's the question. During the pandemic, that's the main priority.
Okay, yeah.
And then once you're throughout the crisis, then it goes back to business as usual. So when defense ministers meet, when foreign ministers, when ministers of finance, how many times the health ministers meet together to really talk about this issue of making it part of the critical infrastructure?
Anytime that is needed, okay. Sophie. If you are in a regular time, you will meet once or twice in a year. But if you are dealing with some kind of crisis, you will meet ad hoc. So it's not important how many times. Of course, it's important to talk between each other, because every knowledge is important. So the experience from Croatia is important, but even in experience from Germany, even it's much bigger country than Croatia. It's important to talk, to share the experience,
and to have it as a priority.
Yeah, that's priority for any country. Priorities in Croatia, it shouldn't be the same as priorities in Germany, but we need to talk, we need to deal with the problems as unique country. So be aware of specific for our country, but we need to be united in any crisis. Not in everyday business, but in crisis we should be united. But if you want to have a resilient healthcare system, we need to deal it before the crisis comes.
Exactly, be prepared.
Be prepared. So we need to talk about the resilience right now, not at the time when crisis comes.
Well, thank you, Minister. So, talking about, I'll turn into Mr. Kluge, talking about being united and operating all together. Now that we look back, it seems that the European health systems performed well during the pandemic. But we know that many countries in Europe continue to face many shortages, be this workforce shortages, financial constraints, aging populations. In your opinion, where do you see the greatest vulnerability of today from the WHO perspective? How should policymakers measure really health systems resilience?
Thank you. And first and foremost, I was one of the persons who raised the hand when I was asked this morning if it was my first time to do Rovnik. And I must say congratulations to Madam Minister and all organizers. I mean, not only for the scenery, but the depth of the discussions and for having global health on the agenda, which I think is a tour de force. Congratulations, Minister. So indeed, the COVID-19, so many lessons, but I always want to point out the remarkable determination of the health workforce, which actually, particularly in the beginning, was also very, very vulnerable. And it was also a very humbling lesson, because we saw that even the strongest health systems actually were much more fragile than we thought. So I would say that maybe the biggest vulnerability, if you speak about resilience, is about the people. As a regional director, wherever I go, I like to talk to the doctors, the nurses, the community health workers, be it in the rural areas and the mountains in Central Asia, or I went 6 times to the front line myself, to Ukraine, or to earthquake-affected areas. I'm quite concerned there, because we see that the health workers are exhausted by permanent and parallel crises. With the European Commission, we recently finished the first ever study in the EU and some other extra countries on the mental state of the workforce. And we see that actually 1 out of 10 health workers have some suicidal thoughts. 1 in 3 has some symptoms of anxiety and depression. So we need to take this very, very seriously. And to measure resilience, sometimes we go a little bit too narrow. That, for example, how many beds you have in ICU. But a system which is resilient, if there's an earthquake, we just saw the tragedy in Venezuela, actually means, can you continue the care for a child with cancer? Can you, if there's a war zone, can you continue to take care of the elderly people with dementia? Can a pregnant woman still have safe delivery? So these are the real markers, actually, of a resilient system. And to put it in 3 points, I would say a resilient system would, number 1, have trusted health workers. There was a lot of deficit in trust, but the people who still were trusted at the peak of distrust were the healthcare workers. And number 2, strong primary healthcare system, close to the people. And I want to here commend Japan for having this universal health coverage knowledge hub, which is very important to have the evidence there. Thank you for this. But also, we're exchanging a lot with China as well, with my brother, Professor Lei Hai Cho, on AI and really primary healthcare as a equality measure. And then the third one is what I call the social trust between the citizens and the governments. Because in my view, the system which will be resilient in the future, if there's another pandemic or crisis, is not necessarily the wealthiest system. It's a system where people trust each other and no communities are really left behind. So in that sense, again, congratulations for having, and thank you, global health here, moving out of social sector and to be seen as a real strategic asset of global health security. But there will be no global health security without equity.
Absolutely. Great points, and I have many questions also on the role of the WHO. So the State Minister of Foreign Affairs of Japan, my first question for you when I was thinking was on thinking about geopolitical competition, how do you see security? But I noticed in your bio that actually you hold a medical license, and you have been a public health expert, and understand that you have worked on issues related to health. So maybe I'll ask the first question related to your thoughts on the issues that we just raised, and how are they viewed from the perspective of the Japanese government?
Oh, thank you so much. Does it work? Yeah.
Yes.
Thank you so much. And first of all, I was very happy, and it is a great honor to be here with you as such a great panelist, and thank you so much. And I'd like to say, regarding the USC, after you mentioned country, and Japan, and we think the global health, including pandemic, of course, and is a critical issue. And based on this understanding, Japan has positioned global health as one of the pillars for its foreign policy, and has been actively working to achieve universal health coverage, we call UHC, ensuring that everyone can access effective and quality health care at affordable cost in pursuit of human security. And specifically, Japan has provided a comprehensive approach through bilateral cooperation and international organizations such as WHO. For example, as a response to the recent Ebola outbreak in the DRC and Uganda, the government of Japan has decided to provide an emergency grant of 3.5 million US dollar. While ODA disbursements by DAC member countries have been on the significant downward trend, Japan's budget for the fiscal year 2026 saw a rise in grant aid for the first time in 3 years, along with an increase in the Ministry of Foreign Affairs' overall ODA budget. We recognize that the international community's expectations of Japan are higher than ever before. Japan will continue leading discussions on global health, of course, including pandemic, and working on multifaceted initiatives in this field, including cooperation that leverage Japan's distinctive strengths. Thank you.
Well, thank you very much. Thank you. Ms. Mabel Lumia, I would like now to move into the bigger picture, and maybe we'll go back into the opening of the speech, of the introductory speech regarding the Arctic. And we know that the Arctic holds an estimated 13% of the world's undiscovered oil, 30% of undiscovered natural gas, and as well as significant deposits in terms of critical minerals. China has declared itself a near Arctic state, and it actually invested very much in the last years, decades, I'll say, into the Arctic infrastructure. So what is the view from Beijing when it comes to the Arctic?
Thank you for having me. It's my great privilege to revisit Dubrovnik and participate in this fantastic forum, which is a beautiful place and a wonderful platform for global governance and multilateralism. And I really appreciate the topic today is many directions, but only one future. I think it's a shared future for all of us. Regarding your question you posed about the Arctic Circle. Yes, China is the near Arctic Circle country. China built up a lot of infrastructure for the shared future. It's my point of view as I'm not from the government. I represent a non-government think tank. But today the theme, our topic is related to melting ice and rising stakes, which is brightly captures the anxiety, collective anxiety of the area. I want to challenge a little bit about the prevailing narrative which dominates similar discussions about the geopolitical competition through that kind of critical minerals or the materials. I think it's a public good for the human being, for the shared future. So as you mentioned, China's action or the other countries' similar actions around that region, I think it's a kind of human action for the rare earth development. We need the rare earth development, we need that infrastructure, and we look at the melting ice or the risk for the critical minerals, those issues. Too often we look at through that kind of narrow and zero-sum games lens of geopolitical competition. We are increasingly hearing that kind of saying languages like the weaponization, de-risking, decoupling, or the building the small yard with the high fences. But let us be clear, if we treat the essential global supply chains as the battlefields for the strategic dominance, we will inevitably fail to secure the green transition and the global public health architecture, what we mentioned. I think it's a common good for the human being, like U.S. withdraw from the WHO, but China contributed 500 million to WHO. I think those platforms is good platform for all the infrastructure and the human being well-being.
Okay. Well, thank you very much. I like what you said, put all those topics together, and you said it's a matter of collective anxiety. So you mentioned the critical raw materials too, and how we should work together. So, well, I think it's easier for China because it has the control of the most critical materials. Now, from the European perspective or other countries' perspective, when you do not control, you only control 2% of those materials that are needed actually for it becomes a source of anxiety. So I'd like to come back to exactly to your point on anxiety and how those resources can be used, can be managed, can be weaponized in some cases for political reasons or for economic reasons, purely economic reasons. And that will bring me to Dan, senior fellow at Hudson Institute in the U.S. for the U.S. perspective, but maybe U.S. a little bit also NATO. So, I mean, all the Arctic Park is considered part of NATO's northern flank, and it has come back to a lot with strategic prominence now. We have seen in the recent year Finland's and Sweden's accession membership to NATO. We have seen the increased Russian activity. We were mentioning Chinese investment in the Arctic infrastructure. From where you stand in Washington, do you think that NATO institutionally and militarily is prepared to treat the Arctic as a primary theater of great power competition or not?
Well, thank you again for that question. Yes, I think when you think about the upcoming NATO summit, the topics are going to be the two most important topics are going to be defense spending and Ukraine, but they both tie into the Arctic. And when you see where the alliance is now compared to was just a few years ago, it's really been tremendous change. There's been a number of exercises just a few months ago, the cold response exercises. There's the Operation Arctic Sentry, which is sort of creating one overarching operational approach towards security in the high north and the North Atlantic. Arctic Endurance, which is the Danish-led exercise. Task Force X, which is going to start trials later this year. This is a digitized multi-domain maritime and situational awareness in the Arctic and the high north, both manned and unmanned systems. These are just sort of NATO-level approaches, I think, towards the region. And then you have country-specific regional approaches, the Nordic Air Force Unified Command, the opening of forward land forces in Finland. So I think that there is much more of a focus on the Arctic region from NATO. There's clear evidence from intelligence that the Russians are upgrading a number of bases there. They're going to need to do something with the masses of forces that they have. So we anticipate that'll be something which we'll see. And it was interesting, I think, in the Secretary General talked about Russia's increased military activity, but also China's interest in the high north when it was talking about the Operation Arctic Sentry earlier this year. So I think that sort of competition is also driving sort of NATO's approach to it. It's driving the U.S. approach. I think U.S. is, for a long time, the Arctic felt so remote from continental United States, but now I think it's much more central in terms of the way that the U.S. is sort of formulating its policies in the region. And certainly I think those concerns around strategic choke points are also in the picture and in the mix for the United States.
Thank you. And that brings us to the strategic choke point. So I'd like to go back to State Minister Kunmitsi. So let's bring it to the broader conversation of geopolitical competition and the wavering international order that we have been all talking over the last few years. What kind of security policy is Japan promoting, and where do you see, also based on the title of this conference? Yeah. So yes, I'd like to hear your thoughts.
Thank you so much. And I'd like to explain about our Japanese and the first priority policy, which calls FOIP, Free and Open Indo-Pacific, to strengthen the international security. And what's currently many countries, of course, in Japan, including Japan, are facing an increasing severe and complex security environment marked by intensified geopolitical competition, as you say, and technological innovation and the emergence of new social challenge. And 10 years ago, under the Abe administration, Japan proposed a free and open Indo-Pacific FOIP and has since led efforts to advance peace, stability, and prosperity in the region through ensuring a rule-based international order, including the rule of law, freedom of navigation, peaceful settlement of disputes, and promotion of free trade. And last month, Prime Minister Takaichi first female prime minister in Japan, and announced that updated free and open Indo-Pacific as FOIP celebrated its 10th anniversary this year. This plan aims to maintain the core principle of FOIP, such as freedom, openness, and inclusiveness, while advancing cooperation initiative to acquire the resilience and the capability to have freedom to decide for themselves in the challenging international environment, and thereby striving for the entire region to become more resilient and prosperous together. The base premise of FOIP, that the Indo-Pacific region holds the key to the peace and stability of the future international community, remain unchanged. Japan will continue to fulfill its responsibilities in this region, working to build a free and open international order. At the same time, the value that FOIP passes are universal and not limited to the Indo-Pacific region. As the security of the Euro-Atlantic and Indo-Pacific has become increasingly inseparable, Japan will attach the great importance to cooperation with the EU and NATO. In this spirit, I'd like to call on all of you present here today to lend your strong support to Japan's FOIP vision. Thank you so much.
Well, thank you for your points. And I'd like to go to Ms. Mabel. So we're talking about critical mineral supply chains, Arctic governance, global health security, all issues that are important for all of us here. Do you believe that they all suffer from the same structural problem, which is that the multilateral frameworks that were created were designed to manage all those issues, actually were built for a different era? Now everybody's talking about great power competition, strategic competition. Where do you see the space from China's perspective? Where do you see space for genuine, really cooperation and joint governance in these fields?
Yes, thank you for the question. It is actually, indeed, we need the platform and the mechanism for the multilateral cooperation on those very important topics like the rare earth and raw materials and those issues for the accelerating our green transition and the public health, to avoid another pandemic, or to how to work together through the multilateralism. For example, we mentioned about the rare earth. It's a quite important topic today. There are some things that China is manipulating that kind of concentrated processing capacity to control for the strategic intention. But from my observation, it's just because of the history. As 30 years ago, when the developed countries find that it's a high polluted and high energy consumptive, those industries should move out from their country. Then they move out to China. Thanks to China's skilled workers, the complete system, and consistent policy, China took over those industry and work it very well. Then we supply the predictable, stable, and high quality products to the rest of the world, accelerate the modernization and the industrialization of a human being. But right now, a lot of voices blame China is doing the kind of controlling for the strategic intention. But I think just because of history, right now, we should work together through that kind of dialogue, through the mechanism, maybe through through the G20, maybe G20 energetic working group, we can work together to distinguish what is legitimate supervision, what is the public goods offering. We also can work with the WHO, those mechanisms, to build up the common rule of law, to do some distinguish between the different supervision and the real market need. So I think we can work together. And even from China's perspective, I find they can work with the third parties like ASEAN countries or the other developing countries to work together, even in the future with Japan. I know right now a lot of wasteful wasteful capacity happening in the rare earth industries as the brand new restart of those industry for the rare earth producing happening in the other countries to restructure that kind of the supply chain for the rare earth. So it's kind of wasteful. It's not helpful for the global governance if the world divided into the block confrontation because of the rare earth. So a lot of hype up those narratives. I don't think it's good for the development for the future and for the sustainability. I would like to echo what the Deputy Prime Minister last session of Croatia mentioned, that we don't want the security or those narrative to be the opposite of the development and the sustainability for the world.
Well, these are all great points, but how important do you think should a fair level playing field be in order to achieve this kind of cooperation, to work on the same rules, same standards? How important is that?
It is very important. As I mentioned, we need to build up that mechanism through the multilateral platform, like G20 and WHO, those mechanisms to do that. We need it's an inclusive one, not like some country right now build up the so-called, it's an exclusive cooperation on critical mineral. I think this is very inclusive. It will lead to a kind of block foundation or ideologic foundation. It's not good for the world.
And that's one of the areas that we need to discuss. We cannot separate and take them separately. What maybe something that we have done in the past. Well, thank you. So I would like now to turn, since we're talking about multilateral institutions at WHO, more times the WHO has been asked to do more, but not always has been given the authority, and most important, the resources to do more. So in your opinion, what reforms are necessary inside the WHO in order to make the organization fit for an era which actually we see overlapping of health, climate, and geopolitical crisis?
Thank you. So I have to make a confession here that I am WHO's greatest advocate, but also its greatest and harshest critic.
Because you know it from inside better than we do.
Yes, but we have also been successful, according to the member states, in making that change. Because you're absolutely right that if WHO is overextended, under-focused, and the way that we are financed and governed, what will happen is that we're going to ask more and more from member states and deliver less. At the same time, all these issues I'm hearing, climate change, the heat waves, the pandemics, they have no passports. So one country cannot solve it alone. So what the world needs is not a weaker WHO, but a stronger WHO. And we have many supporters. I mean, China, Japan, the EU, Croatia, but we have to be very, very proactive. How did we do it and square the circle in the WHO European region, which is the region with the largest number of member states? It's not only the EU, it goes from Greenland to Vladivostok, Central Asia, Turkey, Israel. We implemented 3 interconnected work streams promoted by the UN Secretary General called the UN 80. Number 1 is going back to the core mandate. Because if WHO tries to do everything for everyone everywhere, we're going to be excellent at nothing. So we used AI and asked the 53. It's a matter of asking our countries, what do you see as the core mandate? We had a great bilateral with Madam Minister of Croatia, and there one of the global goods we say, every country says, is data. We have to ensure that we have the data every country and person can trust and know how to rely on. Number 2, efficiency and accountability. And I really appreciate, Madam Moderator, you mentioned joint accountability, because member states not to ask WHO to do something that we don't have the means. But if we have the means, we have to be held accountable, because WHO is a combination of Secretariat and member states. And number 3 is restructuring and alignment. We convened the retreat of the 25 regional directors of United Nations working on sustainable development in the European region, and agreed who is going to do what, not to compete with each other. And maybe the biggest point here is that the knowledge doesn't need to sit in Geneva or in Copenhagen. What we need to do, and we're doing in the European region, is to take advantage of the tremendous national expertise. I came here straight from Imperial College London. We discussed with the Minister, opened the first collaborating center in the world on fatty liver disease, and was the Minister of Egypt there, who had done amazing things on hepatitis C elimination. I was in DRC, Congo, a month ago. No country in the world has such an expertise like Democratic Republic of Congo on Ebola. So what WHO needs to do is to make sure that that expertise that each single of the 190 countries have is available to other countries and strengthen it. And then finally, focus on science and make it transparent. And number 3, very important, to be politically neutral, which is not easy. I myself, the last 5 years, I had a lot of pressure because countries say, you should not choose sides, as long as you choose my side. But we cannot. I'm choosing the side of the vulnerable, of equity, because there may be wars, but people should not suffer. We should work with every country, including those who for the time being are not member. Thank you.
Well, thank you. Minister Hustic, so when we were talking about the health security before, but actually we started talking about the resilience of supply chain in Europe during the pandemic, because we saw that, one single point of rupture, then the entire, entire systems, the entire supplying system for medicines, for medical equipment, etc., was completely broken for a short time. So from that perspective, we have seen that the EU now has some momentum. There is momentum in the EU regarding legislation on EU health issues, on the Critical Medicines Act, Biotech Act, talking about the science, AI Act, medical devices regulations. So there are so many regulations, new regulations in the European Union that's trying to improve and reform. We're talking about reform the European health system. So do you see that as a priority in the EU? And then my second point is that what political and budgetary trade-offs actually will be unavoidable in the next decades, because we cannot treat all those challenges that we were mentioning as putting them in the same basket of priorities. Something has to be more important than the others.
Yeah, you're right. So it's an excellent question. As continues the Mr. Kluge have said that he didn't need to take a side unless he chose my side. So to be in a correct way, you need legislation to be exact, to be, I will say, widely possible to implement, and European Union made a huge progress in that legislation, because one disruption during that field of getting the medicine on medical device, so you don't have healthy people, you don't have a healthy system care if you don't have a medicine, if you don't have a device. But you need to have legislation. So European Union made such a progress, and it's very important to say that even in European Parliament, Croatian Parliament is speaking about that, about the legislation. So it matters from where you come, and it doesn't matter from how big country you come. But in a manner of healthcare system, it doesn't matter where you live. But it seems like already everyone have said that the exact the situation need to be affordable to any nation, to any people, and to any population. So yes, you're right. The legislative of European Union is near the end, and it's based on, I will say, 3 important things. So we need to think about how affordable medicine and medical device is. Do we need it for a short time, or do we need it for term in a resilient healthcare system? This is the important thing, but nevertheless, the second biggest important thing is how we through the medical data. From my point of view, not just as a medical doctor and as a Minister of Health, I think that we can do harm and we can do a good thing if we, how we choose the medical data that we have. And this is, at least for Croatia, is very important to be part of bigger family. Because any country is strong enough and is resilient enough as much as contribute to bigger things. So yes, you're right. Legislation is something that we need, and I think from European Parliament that we are in the next step, and that the all legislation will be done in a near future.
Well, thank you. Dan, the last question for you. So we were discussing all these topics, and I'd like to hear your perspective. Also, the main motto of the U.S. government, the U.S. administration, is that economic security is national security, and all the issues that we have been talking about until now are issues of national security. So I would like to hear your perspective from the U.S., but also from in terms of the transatlantic cooperation. On those issues. How important is that? Although there are frictions in the relations between both sides of the Atlantic, how important those issues are, and maybe singling out that another an important point of collaboration has been the one on critical raw materials. That there's a partnership now. There's a task force between U.S., European Union countries, and Japan is also part of that task force. So what's your take?
The U.S. and Europe share a lack of trust. I think that started in the COVID with the obfuscation of this in the early days, which really magnified the impact of the pandemic. That continued. I think we did see the weaponization of critical minerals, choking off supplies to factories, and I think that that's now moved into concerns about pharmaceuticals. Especially generics, and 90% of those in the United States are coming from elsewhere. And so I think that it's also brought the U.S. and Europe back closer together because we share these dual challenges. And so why are we no longer making active pharmaceutical ingredients? The chemicals go into it. Why are we no longer refining? Well, in part it is because these are dirty, environmentally difficult procedures, and we didn't want to do them anymore. It's also an issue of workforce, labor costs, government supports, which undercut Western industries and basically drove them out. But now I think you've seen sort of the mindset in the West change about whether or not the government should be active in trying to reshore some of those to try to reinforce the security. And it's not about sort of breaking a monopoly, but it's about being able to sort of overcome a future choke point to move to a better space. And so I think that we've seen the U.S. and Europe working on both the critical minerals issue, but also the pharmaceutical issue, but they're coming at it, I think, with different tools. But I think ultimately they're trying to get at the same place. And so I think as much as the U.S. and Europe can sort of be working on parallel tracks, it's going to bolster the security, I think, in both of those areas, which I think are going to continue to be choke points in the near and in the longer term future.
We have a little more than 1 minute left, and I'd like just to go quickly at every one of you, and for 20 seconds each, if we had to consider all those challenges and what will be the one word that will explain the solution to those challenges, what will that be, Dan? Or what comes to your mind when you put all those issues that, rising stakes, critical materials, geopolitical competition, global health, climate change, all in one basket? What comes to your mind in terms of solutions?
I think it's actually going to be something which is going to hold the transatlantic alliance together, because these are joint challenges that I think that we can work on together. I will also say really quick, there's also really interesting bioprospecting opportunities in the Arctic, which I think could be something very positive note for the world. Thank you. Please.
Yeah, I still want to emphasize that block-based and fragmented cooperation will suffer all the people on the earth. So I think we should throw the true multilateral, genuine multilateral system to improve that and work together for that.
Thank you, Mr. Kluge. So we have transatlantic cooperation. We have multilateralism.
If I need to check one word, I would say trust.
Trust. Thank you. Yes.
Solidarity.
Solidarity.
Yes, for the international peace and stability and prosperity.
Minister?
Affordable solution.
Affordable solutions. Well, thank you very much. So I think we came, it looked very difficult. Unfortunately, we don't have time. We have to respect your time, and there's a panel after this. But I think, what brings all these, one key words together, I think we go back to the opening speech. I think it's the resilience of health systems, resilience of governance frameworks, resilience of supply chains. And with that, please join me in a round of applause for our panel.